Thalassaemia International Federation, although was established with a vision of a very small group of patients and parents back in the 1980s, patients that came mainly from countries where they had successful prevention and management programs, because their countries had realized the immense medical, public health, social, and economic repercussions if this disease was left unaddressed. And in doing so, because these were countries of very high indigenous prevalence of the disease, had developed prevention and management programs without really knowing what were those elements that would really bring success to these programs. Neither was the World Health Organization at the time fully aware of how you can prevent effectively and manage this disease. First and above all, to ameliorate the pain of the patients and their families. Being a genetic chronic disease meant that affected patients, but affected whole families. So even World Health Organization and medical experts, hematologists, pediatricians at the time, because that was a pediatric disease, a fatal pediatric disease in the initial stages, patients were not living more than the age of 8 or 10 years. So they started improvising what were those elements that would really effectively address the prevention of this disease. What does prevention mean? At the time and still today, it means reducing the number of annual affected births in order to reallocate resources, human and other resources, to the living patients, give them better treatments, better quality of life, and manage and address their social integration to be productive citizens. So gradually, patients, parents, healthcare professionals, and World Health Organization and governments together in synergy, it was an amazing synergy at that time, started identifying those elements that could lead to effective prevention, public awareness, getting the people to know about the disease, getting the people to know what the results are, what inheritance means, because you've got to do a bit of genetics, a bit of inheritance for a chronic disease. Blood, the adequacy of blood. What does blood mean for thalassemia? It doesn't mean the same for an acute emergency case of blood transfusion. It means different. It means to have enough supplies, that's to cover adequacy of blood, to raise enough the hemoglobin, to prevent hyperplasia of the bone marrow. It means to appropriately process the blood, to filter it, to store it appropriately. So safety and quality of blood transfusion therapy for these patients means completely different from blood transfusion therapy of other chronic diseases or acute cases. So those issues and those elements came very gradually from experience and gathered together, and then gradually research by the academia and treating physicians came together to put the first guidelines, which were developed in 1999. Until 1999, there were no concrete guidelines on how you can manage these patients and how the disease can be effectively prevented at the level of the government, because one prerequisite that we've all identified since the early stages was that whatever elements you put in a control program had to be centrally coordinated, but very, very importantly funded and supported by national disease-specific systems, programs in the context of national health system. No chronic disease, particularly such a challenging disease, can be addressed effectively if there is no disease-specific program and if this program is outside government support. So this was how the knowledge, experience, And research results were put together in the first guidelines in 1999, first by TIF. World Health Organization had attempted back in 1982, but they were very vague information. It was like standards of care and what was known at the time. The first true guidelines came from TIF in 1999, and that is one of the activities of this federation that they can very safely state that it has and still has and will have for many decades to come measurable impact on the lives of our patients. It was an indirect present of TIF to the patients by educating correctly the healthcare professionals, the treating physicians. You're providing a better future for our patients. And the educational program of TIF, including conferences, seminars, consensus meetings, and publications like TIF guidelines, which was not only for the management, but for the prevention as well, for the nurses, for emergency care. We believe that was a huge contribution, an invaluable contribution for our patients. Many countries have adopted the guidelines as published by TIF. Others have based their own national guidelines on TIF's contents. And we're very, very pleased to see that healthcare professionals, treating physicians, governments, public health directors are using the guidelines for these patients. Albeit we have to note that treatment and optimal care has still a long way to go in still many populations of the world. Although they know about it, guidelines are present, they participate in conferences. I believe knowledge is there, the tools are there, but as the theme of this International Thalassemia Day is addressing inequities, this is exactly what is happening. Knowledge is there, and there is ample knowledge about this disease, contrary to the knowledge about other rare diseases, because these are considered and included amongst the family of the rare diseases. And there are many thousands of rare diseases for which scientists and healthcare professionals are striving for accurate and specific and prompt diagnosis and treatment. But for these diseases, there is ample knowledge of how to treat, how to prevent, what the optimal care is, and even what the social care should be provided to these patients to have integrated and productive citizens. Yet, what's missing, what's the big missing piece from this puzzle is the commitment of the government. We are fully aware that governments have other competing priorities: public health, communicable disease, economies, low economies, poor infrastructures that they're striving to address, other important for them priorities. But we feel as Thalassaemia International Federation that we cannot allow violation, such tragic violation of human and patient rights for a disease that there is ample knowledge. And on the other side, it's a disease that if you care to address properly and you build infrastructure to address this disease, it means you can address public health infrastructure. You can address other medical infrastructures for other diseases. It's a monogenic chronic disease, which if you build infrastructure to address it effectively, there is huge benefit for a number of other diseases as well as public health infrastructure. In Cyprus, for example, we have succeeded in having voluntary non-remunerated blood since the 1970s, with no blood imported. So, and that was based on the effort of the patients, parents, and the doctors to build the resources necessary to address the lives of these patients, which were dependent on continuous lifelong blood transfusion. And all the blood donation infrastructure in Cyprus, and then for many other countries I can name, thalassemia was the cause, thalassemia was the beginning, was the example. So we believe at TIF that addressing hemoglobin disorders, and in particular thalassemia, is not just addressing a disease. You're addressing a plethora of other aspects of a lot of other infrastructures in the area of health.